Life in antiquity was perilous. Warfare, childbirth, food shortages, and illnesses rendered it short, nasty, and brutal. The experience of injuries and illnesses unites humanity across time and place. Diseases have haunted us since our hunting and gathering days, in the savannas of East Africa to date. In the ancient days, medicine was at times effective and other times downright terrifying. Join us in this Liber-Tea episode as we peruse ancient approaches to ailments in the quest for better health and longevity. Contrary to popular belief, the greatest threat to humanity is not war. Diseases, whether caused by bacteria or viruses, are the greatest threat to human existence. How people regard disease has changed little since antiquity. Like our ancestors, most of us still believe that illnesses have supernatural or natural causes, and are thus treated via both spiritual or scientific means. In traditional societies across the world today, medicine is approached holistically. For instance, among the Chinese, Japanese, Native American, and African societies, a holistic healthcare system is comprised of spiritualism, divination, and herbalism. The earliest medical traditions spring from ancient Mesopotamia, India, Babylon, Egypt, China, and Greece. In Mesopotamia, there was a lack of distinction between magic and rational science. When a person was ill, physicians would prescribe both medicinal treatments and magical potions. In medical history, the first prescriptions are traced back circa 2012 BCE to circa 2004 BCE during the Sumerian Third Dynasty of Ur. The Babylonians, together with their Egyptian counterparts, introduced the concepts of physical examination, prognosis, diagnosis, and remedies. In addition, Babylonian physicians introduced the practice of therapy and cause. Like today's physicians, Mesopotamian doctors were frequently faced with mental health issues. As such, they maintained records of their patients' symptoms and attached spiritual meanings or causes to them. For example, mental patients who hallucinated seeing dogs were predicted to be near death, while those who hallucinated seeing gazelles were predicted to recover. Interestingly, Mesopotamian physicians correctly diagnosed that erectile dysfunction was primarily caused by physiological issues. Additionally, sex therapists helped Mesopotamian couples deal with bedroom issues. For instance, in case of impotency, men were advised to crush a male bat that was about to mate in water and drink the concoction. Generally, Mesopotamian medicines were composed of minerals, various herbs, animal products, and portions that remedied physical symptoms. Ointments and enemas were used in some instances. Preventative healthcare practices were common in Mesopotamia. During wars, physicians performed simple surgeries, set limbs, and dressed wounds to stop hemorrhaging and infections. Scenes from Homer's Iliad provide us with a glimpse of ancient Greek medical practices during the Trojan War. For instance, the cleaning of Euphyllus's wounds with warm water by Patroclus shows the use of basic hygiene. However, the most famous medical contributions are attributed to Hippocrates, the world's most celebrated physician during the 5th to 4th centuries BCE. During the ancient days, wounded soldiers provided doctors with the best platform to study human anatomy. Doctors dealing with wounded soldiers treated a myriad of issues, including wounds caused by spears, swords, projectiles from slings, arrows, and spears. Ancient Greek doctors understood the importance of removing objects such as arrowheads and the need to clean wounds properly. Additionally, they knew the importance of stopping hemorrhage due to excessive bleeding. Some texts show that doctors may have occasionally used opium during operations, while others tell that wounded soldiers were held down during surgery as an anesthetic was rare. After surgery, stitches of linen or flax thread were used to close wounds. Bandages soaked in vinegar, wine, oil, or water were used to dress the wounds. Honey, herbal leaves, and egg white were also used to seal wounds. For centuries, in China, doctors utilized 44 biles, including human bile, from vertebrates and invertebrates to cure a host of diseases. Various animal biles were prescribed for curing maladies such as heart disease, liver disease, skin infections, burns, biliary, and gynecological issues. Common carp, dogs, pit viper, and ox biles were extremely popular during the Zhou dynasty. Python bile therapy was applied to patients suffering from venereal diseases, bloody dysentery, high fever, and hemorrhoids. On the other hand, elephant bile treated bad breath and enhanced visual acuity. Bear bile was king, as it was used to treat various illnesses caused by summer heat, such as summer diarrhea and jaundice. Additionally, it treated infantile convulsions, abdominal pains, anal fistulae, and hemorrhoids, and different types of infant malnutrition issues. Child restlessness, infantile dysentery, and febrile convulsions were treated using tiger bile. Fresh human cadavers provided human bile for treating malaria-type illnesses, characterized by sweating and rigors, severe chills, and intermittent high fevers. The sacred text, Atharva Veda, which dates back to the Iron Age, is one of the books that Indian physicians used. The Atharva Veda contains, among other things, herbal prescriptions for various maladies. This sacred text contains details of diagnosis, prognosis, and treatment of various diseases. The Indian folklore medicine system is called Ayurveda. Its primary objective is to enhance and preserve physical, spiritual, and emotional wellness and balance. Unlike other traditional medical systems, the Ayurveda seeks to prevent rather than treat maladies. Toward these ends, it combines lifestyle changes, diet, and exercise. Ayurvedic spices and herbs are used to obtain maximum results. For example, Indian doctors use cumin to relieve bloating and abdominal pain. Licorice root were used to boost immunity, relieve inflammation, and treat skin irritations and digestive problems, among many other things. Turmeric, on the other hand, was used to relieve mental stress, reduce inflammation, and enhance brain and heart health. Many Ayurvedic spices and herbs are still used today. For instance, studies show that turmeric may produce similar results to Prozac, a drug used to relieve depression symptoms. For many years, people thought that excess blood could wreak havoc on a person's health and that bloodletting was the best remedy. In the recent past, physicians have used leeches to perform this treatment. Since 1600 BC in Egypt, leeches were utilized to perform bloodletting and treat various ailments. This practice was so popular that all cultures, including the French, Greek, and Roman cultures, performed it. However, during the 1600s, doctors stopped using leeches, but later the practice came back with a bang, so much that the demand for leeches almost caused their extinction. Thank you for listening to this episode. We hope you have enjoyed and learned about the history of medicine. Like, share, and subscribe to Liber-Tea for more.